Okay, class, there's one more that I wanted to discuss with you. It's called Disorders of the White Blood Cells. If you'll bear with me just a second here, I'll get this up. We'll start it. It says if white blood cells provide protection for infection and cancer development, then protection would depend on maintaining a normal number and ratio of the different types. Abnormally high or low numbers of white blood cells could lead to altered protection and place the person at risk. That is your importance of your white blood cells. Leukemias are the most common form of cancer in childhood. You have broad terms that are given to a group of malignant diseases of the bone marrow and lymphatic system. There are 4 forms in adults: ALL, AML, CML, and CLL. There are 2 forms in children: the ALL, the acute lymphoid leukemia, and the ANLL or AML, which is the acute non-lymphoid myelogenous leukemia. Cytochemical markers, chromosome studies, and cell surface immunologic markers are all listed in your pediatric book. If you would please look those over. Proliferation, rapid or repeated production of the cells. Why does this happen? In all types of leukemia, the proliferating cells depress the production and form elements of the blood in bone marrow by competing for and depriving the normal cells of the essential nutrients for metabolism. The most frequent presenting signs and symptoms of leukemia are the result of infiltration of the bone marrow. The 3 main consequences are anemia from the decrease in the red blood cells, infection from neutropenia, and bleeding from decreased platelet production. Fractures and pain may be seen. Why? The invasion of the bone marrow with leukemic cells gradually causes a weakening of the bone and a tendency towards fractures. Cells will invade the periosteum, increasing the pressure and cause severe pain. Okay, your diagnostic evaluation is based on your H&H manifestations, peripheral blood smears, bone marrow aspirations or biopsies, and your decrease in your H&H and platelet counts. Therapeutic management works better because children with ALL, the chemotherapy works better because with children with ALL during the first remission, they have an excellent result with chemotherapy alone. Prognosis varies depending on the initial white blood cell count. Normal and low is better than a high white blood cell count. The age of the child between 2 and 9 has a better prognosis, and the type of cells involved, sex of the child, girls do better than boys do, and karyotype analysis. Chemotherapeutic agents, your stem cell transplants, drug therapy for infection, and the prognosis, like I said, varies on many factors. Nursing care management, you want to prepare the child and the family for the diagnosis and therapeutic procedures that will be involved. You want to relieve their pain, prevent complications of myelosuppression, like infection, hemorrhage, anemia, and what about their immunizations? You need to see the nursing alert on page 890 of your pediatric book. Pain titrate opiates for a child and an adult around the clock, and use other non-pharmacological methods for their pain management. Use precautions in administering and handling your chemotherapeutic agents. You need to see the nursing alert on page 891. You want to manage problems of drug toxicity. Watch for nausea, vomiting, anorexia, mucosal ulcerations, neuropathies, hemorrhagic cystis, alopecia, their moon phase, and mood changes. Provide emotional support for not only the patient but the family. Okay, in lymphomas, you're going to have Hodgkin's lymphoma is usually seen in adolescence and young adult period, especially from 15 to 19 years of age. It peaks again in adults age 50 to 60. The exact cause is unknown. It contains a specific cancer cell called Reed-Steinberg cells. Now, non-Hodgkin's lymphomas are prevalent in children younger than 14 years of age, and they do not contain the Reed-Steinberg cells. Hodgkin's originates in the lymphoid system and involves lymph nodes, especially the lymphocytes. Ann Arbor staging system is used. A is asymptomatic, B is temp and night sweats, unexplained weight loss over 6 months. You need to ignore that where it says see page 893 in the Med-Surg book. That's not appropriate page number. Enlarged cervical and supraclavicular lymph nodes is the most common presentation. They have fever, weight loss, night sweats, cough, abdominal discomfort, anorexia, nausea, and itching. Lymph node biopsy and a bone marrow aspiration will be done on these patients for diagnosis. Radiation for stage 1 and stage 2. You're going to see fatigue, risk of sterility in adolescence, and delayed sexual maturation. Chemotherapy will be MOPP, ABVD, or COPP combinations, and these are listed in your PED book. The prognosis is good. Early staging with treatment greater than 90%. You have an advanced stage of treatment up to 75%. Nursing management, you want preparation for diagnostic and operative procedures for these patients. Explain the treatment side effects like fatigue, that they're going to need frequent rest periods, and you want to provide the child and family with support. And the Hodgkin's lymphoma is one of the most treatable cancers that there is. Okay, now let's talk about non-Hodgkin's lymphoma. It's extranodal, also involves the GI tract, skin, bone marrow, sinuses, thyroid, and the central nervous system. It occurs more frequently in children than Hodgkin's does. Main difference from Hodgkin's is usually diffuse rather than nodular. The cell type is undifferentiated or poorly differentiated. Anything other than the Reed-Steinberg cells will be seen. Dissemination occurs early and rapidly. Mediastinal involvement and invasion of the meninges are common. Radiation and chemotherapy aggressively are done. Prognosis is excellent for children with localized disease. Is poor if it's disseminated. If remission is over 2 years, it is considered a cure because relapse after 2 years is rare, and the cause of non-Hodgkin's is unknown. Your primary nursing care is directed towards managing the side effects of the medication, supportive care for the child and the family, or the patient and the family. Multiple myeloma is a white blood cell cancer that involves the B lymphocyte plasma cell. This results in an overproduction of antibodies, gamma globulins. When these cells are overproduced, fewer functional red blood cells, white blood cells, and platelets are formed that also lead to excessive cytokines, increased cancer growth rates, and destroyed bone. The cause is unknown. 20% have no symptoms at the time of diagnosis. You'll see elevated serum total protein, paraprotein in the blood and urine, fatigue, anemia, bone pain, fractures, infections, and renal dysfunction. And there is a staging system. Treatment is minimal. You want to watch and wait. Chemotherapy is the standard. It is incurable, and they are trying stem cell transplants at the time. And that was a quick overview of the few white blood cell diseases that we're going to be going into. As I've said before, Miss Lindsay will be doing the immunologic portion with you, and she will go into greater detail with that. Well, I hope this has helped you some with understanding the hematology of the body. As I've said before, please feel free to text me, phone me, email me if you have any questions or concerns. And I hope you have a great week. Remember, just take a deep breath and study. I hope everybody has gotten a little more well organized since we're the 5th week in, and I look forward to seeing everyone in the clinical setting.